Welcome back. Joining us now, the governor of Maryland, Larry Hogan. Governor, a lot to talk to you about what's going on in the state of Maryland. Let's start with the accessibility and the availability of testing. I know there's some local reports of Johns Hopkins doctors trying to develop their own tests. Does Maryland have enough tests?
Well, I don't think there's any state in America that has enough tests, but we're all working as hard as we possibly can to change that situation. And it's really going to take both the federal government and all of the states to be acting along with the private sector. Johns Hopkins, we were one of the first states, if not the first state, to be approved to do our own testing. And we've got some tremendous medical facilities here in the state, Johns Hopkins being one of them. And they're ramping up, and we're working with private labs. But this is one of the many issues that we're dealing with, is ramping up with these private tests. But it's really, testing is only one part of the situation. You know, we've got an emergency coronavirus response team made up of some of the smartest doctors in the world from Johns Hopkins and University of Maryland Medical System and some of our top hospitals, that we're working now on surge plans and ramping up to try to add quickly 6,000 hospital beds, and to figure out how we're going to deal with, our social distancing efforts are trying to flatten out that curve, but we're also I've ordered them to try to come up with a plan to ramp up 6,000 additional hospital beds as fast as possible, opening closed hospitals, transitioning hospitals, working with the private hospitals, with our state hospitals. We've called up 2,200 members of the National Guard, including 3 corps of medical people with medical expertise. And so we're looking for the federal government for help with all of those things, but we're also acting on our own and acting with our private sector partners, because it's going to take every one of us working together. We don't have time to wait.
Yeah, so Governor, tell me, how are you balancing the needs of your people in your state regarding their health care versus obviously their economic needs, their economic concerns? You've had quarantines put in place in San Francisco. They're debating it in New York City right now. What are you thinking for Baltimore? What are you thinking about the rest of the state?
Well, so I think we were maybe the first state, or one of the first states, to declare a state of emergency like 15 days ago. And we've been taking unprecedented steps almost every single day. We're, I think, the first to close all of our schools in the state last Thursday. We took major steps for social distancing, closing all the bars and restaurants and nightclubs and every other facility out there. And that's really absolutely necessary. It's inconvenient, and it's scary, and it's disrupting people's lives, but it's absolutely critical to save hundreds of thousands of lives. But we understand fully that in addition to that immediate need of saving people's lives and protecting the health and welfare of everybody in our state, that it's going to cause tremendous economic harm. And we're trying to address those issues as well. We passed emergency legislation through our legislature to deal with things like unemployment benefits and providing money for assisting some of these smaller businesses. And we're happy that the Congress seems to be acting in a bipartisan way, which is kind of an unusual thing for Washington. But getting things done quickly, trying to deal with some of these economic problems, because we know that's the next coming wave. But quite frankly, we got to do both at the same time. We're looking at the first, saving people's lives. Second, how are we going to deal with the fallout economically?
Hey, Governor Hogan, it's Willie Geist. Good to see you this morning. You're the chair of the National Governors Association.
Yeah,
so you speak for a lot of governors across the country who are hustling and doing a great job at a state level trying to contain this and to mitigate it. If you had an audience with President Trump, if you had an audience with the coronavirus task force, which you may very well as you speak here this morning, what would you say to them? What does not only your state need, but what does every state need on this morning, on this day?
Well, here's the good news. I am the chairman of all the governors in the country, and we've had 3 meetings with the vice president, one with the president, where we had a conference call. I was in the Situation Room twice, but the rest of the governors were on a conference call. And we've been talking on a regular basis and communicating well, and we've all told them exactly what we need, but it seems to be changing every day. So we have another call today with all the governors at NGA. Later this afternoon, I think we'll have over 50 governors, including some of the territories, talking once again. But you know that we've been pushing a lot of issues. It's about getting the PPEs, the personal protective equipment. It's about testing. It's about getting, just every state is dealing with this, and we need help from the federal government. Each governor we're really on the front lines of this, and each state is in a different situation, but we're really all in this together. Look, I know there's been some criticism back and forth. I'm not here to finger point about who didn't do what yesterday. I just want to focus on what we can get done today, and that's really what we're trying to do. And we're trying to put aside all this Republican, Democrat, the White House this, the Congress that, and the governors. Every one of us, we're all Americans. We got to put aside all that stuff and just get this job done, because we, frankly, don't have time to wait.
And that's why I asked the question, Governor, because as you said, it's different every morning. So I understand your needs. What about the hospitals? Yeah. We've heard from different governors, hospitals sort of sounding the alarm about not only what's coming, but what's already here. What are you hearing from those, as you said, world-class hospitals in the state of Maryland about what they need this morning?
Yeah, well, Maryland, we're not only the home of Johns Hopkins and University of Maryland, but NIH and FDA, and we've got some really smart folks, and the needs immediately are just looking at, if we don't flatten this curve out, the overwhelming, catastrophic demands on the healthcare system. So we've done things like, not only are we ramping up this is in consultation and working collaboratively with the private sector hospitals, with our health department, and with our National Guard and everybody else that we can find. We're ramping up those 6,000 beds. We also activated a core of 5,000 people that are licensed professionals that we've got, I think, 800 of them now signed up to immediately go into action. We called up these National Guard folks with medical capabilities, but we're not going to have enough doctors and nurses, some of whom are getting infected and sick or being quarantined. We're not going to have enough hospital beds. We're not going to have enough personal protective equipment, and we don't have enough tests. So it's everyone's drinking from a fire hose and doing everything we possibly can, and it changes, as you know, as you're covering this. It changes not day to day or hour by hour, but almost minute by minute. I mean, the pace of this is just staggering.
Yeah, Governor, the former lieutenant governor of your state, Michael Steele, has a question. Michael?
Hey, Governor. First off, as a citizen and resident, I want to thank you for the effort. It has been amazing how it's all come together. I want to expand, though, beyond the state of Maryland in light of everything that you've said. On a regional basis, how is that coordination in the DMV, between Maryland, Virginia, and the District of Columbia with the governor and the mayor, number one? And number two, is there any thought to a shelter-in-place moment that you are considering as governor, or that is being considered in the region to act in a concerted way to get ahead of this virus in light of everything that you've done on the surge front, on the testing side, et cetera?
Well, yeah, thank you, Michael. We are working well together with the folks in the region. You know, after we took action to close all the bars and restaurants, not too long after that, maybe 4 or 5 hours later, the mayor of the District of Columbia, Muriel Bowser, did the same thing in D.C. Yesterday, Governor Northam took some pretty aggressive steps as well. We're all talking on a regular basis. We made some suggestions about what to do with the Washington Metro system, and relatively quickly, a couple of hours later, they all agreed, and we took steps yesterday to kind of limit service, to cut down to just the most important people that really need to get to where they need to get to, so we're not spreading the virus more on some of our transit systems. So we're working together, just like the Governors Association. The regional guys are working together. I mean, I'm on the phone constantly with the folks in our region, people all across the country. They were on many of our discussions with the governors and the vice president. They'll be on the call with us later today. But as far as the shelter in place, I mean, that's kind of the next wave. There's obviously really smart people in our Maryland Emergency Management Agency and our coronavirus response team that are discussing every possible eventuality. But I mean, that's not something that right today we're looking at. Right now, we're looking at everything we can do to keep people in their homes, social distancing, and ramping up our capacity to deal with this crisis from every direction.
Just, Governor, we've got a few seconds left, but would you support the president mobilizing the military on a national scale to build military hospitals and do other things to combat the coronavirus?
I think if the president or his team feel that there are missions that they can do, then I certainly would support it. Like I said, we have already called up 2,200 members of our Maryland National Guard, so we're using the military. We already have been. We had 400 of them activated last week, and we've activated more. I'm not sure how fast they can build military hospitals, but like I said, we're opening closed hospitals. We're putting up tents for triage areas, and absolutely we could use the help of the national military.
Maryland Governor Larry Hogan, thank you.
It's going to take
very
everybody.
much.
Thank you.
Yes, it is.
Yeah, sure is.